Good evening, everyone, and thank you for joining us for another episode of Advocacy. Tonight, we have a wonderful show to talk about patient advocates, and we have Miss Ashley here with us. Of course, I'm Paula, we got Bunny, and we got Madeline with us. So, we're going to jump right into the subject. Ashley, tell us a little bit about yourself.
Sure. So I'm a registered nurse, been a nurse for almost 14 years. I started in the emergency room down in University of Maryland, which was an interesting place to start. I loved it, but I wanted something different, something where I saw through what was happening with patients after the emergency room. So I started working in home health care. And I did that for 4 years, and the company got bought out. And then I started as an infection preventionist during January of 2020 at a nursing home. So we all know what happened.
Mhm.
Shortly after that, it was extremely stressful. I learned a lot, though. I have my master's from University of Maryland in clinical nurse leadership, and I think that job really brought out my leadership skills because I was the leader. I was the only one there doing, leading the team with the infection prevention during a pandemic. So I grew a lot doing that. Eventually got recruited to work at LifeBridge, and I started there going into nursing homes and teaching the staff about different things for infection prevention, how to take your PPE off properly and put it on, and where to store soiled, gowns and all that sort of thing. And then that grant dried up. So we were then transitioned into transitional care nurses, where we followed patients from the hospital to rehab to home to prevent readmission. And I really love this job. It was kind of like a consulting job. You would go around to different facilities and speak with different patients about what the process is supposed to look like, how things happen when you get home. And I realized when I did that I could only do LifeBridge patients because of the continuum of care. So, legal purposes, obviously, but there was always people, in the background or roommates asking, hey, can you do that for me? And, I thought, I wish I could, but I can't because I can only take patients who are out of this hospital because that's who I work for. The wheels kind of got turning at that point that I wish I could advocate and do things for other people, but I just never had, the guts to go and start my own business. And after a while, I started looking for other jobs because that job kind of slowed down a little bit. And I started working at the health department, which I loved that job. I ended up getting sick with multiple autoimmune diseases. So I have Graves' disease, which I got after my daughter was born, and colitis. And both of them got exacerbated by stress. Unfortunately, my sister was one of the construction workers killed on 695 years ago. And that really kind of put my life into perspective that I don't want to do something that I don't like doing. And I really want to help people, and I want to help people the way that I want to help people. And so it was the 1 year anniversary from her death, and then all the court cases, everything were happening. So the stress in my life was beyond what I could really handle. I had to come out of my job. I stayed home with my kids. I have twin 10-year-old boys and an 8-year-old daughter who are very active and, go to the elementary school down the street and all that sort of stuff. And I stayed home with them in the summer, and then I had to get my thyroid removed at the end of the summer because I just could not get my my autoimmune, the Graves' disease, under control. And so I was trying to coordinate between a cardiologist, my GI doctor, my primary care doctor, the surgeon, and then my endocrinologist. And I thought, how in the world does anybody do this if they don't work in the health, in healthcare, or even have somebody, if that, an advocate for themselves? Because, they go get an EKG. I'm like, where in the world do I get an EKG? I can't go just get an EKG. Like, it's not possible. You have to do it as part of a visit. So it was a lot to navigate. And again, that's where I really was like, oh, I wish I had, other people, I reached out to groups, thyroidectomy groups on Facebook and whatnot, to try to get some little tidbits of information from people to kind of help make my recovery smoother. And then I recovered from that. My mom was diagnosed with dementia, and so I was helping coordinate her care, going, from her neurologist to her memory care doctor, primary care doctor, and doing all of that for my parents. And when I did that, I was like, okay, I really see how much this can help other people, and I'm going to do it for other people. So last October, actually, amazingly enough, my LLC became active on my sister's birthday. So I took that as a sign that this is something that I am definitely meant to do. And so last October 7th, almost a year coming up now, I started my own business, Guidewell Patient Advocates. And that's exactly what I do. I help other people navigate the healthcare system and let them know, they have a voice too. It's a lot of elderly people that I help. I mean, obviously I can help anyone, but, people who don't have family members close by, mom and dad, or mom wants to stay here and all the kids live, I have a client the kids live in Hong Kong, and the dad is here by himself and really just needs an advocate or somebody close by that can keep eyes and ears on him. But I do anything from Medicare appeals, helping people make sure they stay in the nursing home to get their rehab so they can go home stronger and hopefully not come back into the hospital as a readmission. I help people figure out with like the service coordination if they qualify for community waiver programs. And different things like that, like the REM program, the rare expensive medical program that Maryland has. I'm assuming other states do too. But, just kind of thinking outside the box and helping people understand that, it's not always black and white. You might have to look other places and really advocate for yourself. So that is my story.
Wow.
You are busy.
Story.
Oh my goodness. Ashley, while you were talking, I was like, I want to be your advocate to help you. So I'm so glad that you have come on the other side of all of this and you are now able to help others. My gosh, you have you've got a terrific story, and I'm just so glad that you're on the other side of it now and you're able to help.
Yeah. And I find that, it's not just about this or that, but it's like the whole picture. You know what I mean? Like you can't take care of other people and help other people until you take care of yourself.
Yep.
And so, in the beginning, it was a lot of hustling, getting out there, talking to people. But I feel like now I'm trying to make time for myself. Every morning I do a focus time where I block my calendar off. I go exercise. I drink coffee on the front porch if I want to for half an hour, whatever it is, just to make myself be more open for other people. I really try to do that. So
that is so important. And I'm glad you said that. But first and foremost, I think, we call it in our church, our ministry. I think every ministry is birthed out of firsthand experience. And I think, I know all of us could say, like, listen, like when I'm going through something, I wish it was somebody that could deal with this. And I wish it was somebody that could help me with this. But it's surprising because it seems like the spectrum for help is from here. It's just like the autism the autism spectrum. It's everything has a spectrum, and it's like from here to Japan.
Right.
But as much as you go through things, you would think, okay, I know it's some type of organization or some type of help for this. And when you're going through it, you find that it's not. And that's where a lot of the time the need comes in. The need comes in a lot of the times when you're going through your own experience and you realize that there was no one there that could do specifically the things that you need them to do,
Yeah. Exactly.
Right. That's what I was, like you were saying, I've been on this side with my mom and me in the hospital and things not going right, and trying to talk to the doctors and to get insurance, all that. And then on the other side, and again, asking for help and getting the right help, and some people say, or give them the minimum help, or they look at you and already have a feel for you, so they won't give you extensive help,
Mm-hmm.
But my question is, how, this is very interesting. What was the process? Like, how did you actually start it?
So I obviously am a nurse by trade. I don't know anything about business. And I will tell you that my best friend is AI. I asked a lot of questions and watched YouTube videos on how to set up an LLC. And I asked, I have a cousin who's a lawyer, so I was asking him, and then I quickly realized that real estate law is a lot different than what I was trying to do. So I went and hired my own lawyer. And so it was really a lot of trial and error. I figured out how to make my own website, so I didn't have to pay money for somebody to do that for me. Mm-hmm. I did all of the paperwork for the LLC on my own. Actually, there's a lot of programs called SBDC. It's the Small Business Development Centers that it's through the county in most states. And it's they have like free business coaches. I mean, obviously it's not like somebody you're going to spend $10,000 on who's going to be one-on-one with you all the time. Right. But it was a good start for him to go over, what this looks like, marketing, what that looks like. And then, then I started talking to more and more people, and they were saying, oh, you should come to this group. I don't know. I know you're in PG County, you were saying. And so in Carroll County, Baltimore County, there's groups that are specific for people who help seniors. So they're in Carroll County, it's SPIN, Senior Provider Information Network. And then in Baltimore County, there's BCPC, Baltimore County Provider Coalition or something like that. I just call it BCPC. And it's a group of people who all get together who help elderly people. There's home care agencies, there's people who do the placements for assisted livings, all that sort of thing. So that's kind of where I started with my networking, and then met a lot of people that way, and grew, my list of resources, and joined business groups so I could, and like, I don't work all by myself. Like if I don't know something, like for example, some of the policies for insurance and all that sort of thing, I have somebody that I kind of bring in and that, because somebody who may want to do the 5-year look back for the Medicaid application as you get older for the long-term care. I know about it. I can tell you a little bit about it, but I am not a lawyer, and I have resources though. So that's a lot of what it is too, is really just sharing people resources that they may not even know existed before,
Exactly.
So how do you have to become, I know an advocate, I don't know how far that goes as far as guardianship and anything like that. Is that something that crosses over into the legal realm of things?
So guardianship, I mean, I can help people with that. I don't usually do guardianship for other people. I know there are some people who will be like their medical power of attorney or whatever it is, but I don't feel comfortable doing that. And you kind of, it's like a on-call thing. Like I have 3 kids, I can't really be somebody who does that. But
well, I guess maybe wasn't framing my question correctly. I guess my question is, being an advocate, do you have to have some type of papers on file, or how do you help with that if it doesn't cross over into the legal realm? Because say somebody is in the hospital and they need assistance, can you just walk in there and advocate for them with the doctors without having documentation signed and everything? How does that work?
So when I sign on clients, they have to sign a release of information saying that they're allowing me to come in and talk to the doctors for them or with them. So I always get that signed by my clients or their durable power of attorney or whatever it may be. And I bring that with me or send it to wherever I need to go. And I do think, being an advocate, there is a BCPA, a board certified patient advocate exam that you can take and pass and put that behind your name. But, a nurse, obviously, I feel more people know what a registered nurse is than a BCPA. And I do think that also has a lot of credit, that I went to nursing school. I've had that clinical background and all that sort of thing. And I think that you look at things differently, obviously, and you see things like somebody may hand you a page of 20 documents or whatever. And, I can usually scan through them pretty well and be like, oh, what about this? And like, oh my gosh, I totally missed it. I didn't even see that they wrote that. I needed to do that. You know what I mean? And I think that when you come into a doctor's appointment or into the hospital and you know what you're talking about and it makes sense. And it's also always about the approach too. I don't go in pointing fingers. I always say like, we want to play nice in the sandbox together.
Right, exactly.
And and for the most part, obviously most people want their patients to be taken care of and do well. They just don't have the time. The doctors don't always have the time to research everything about the client or the patient. I had to get used to saying client. Now I need to say patient sometimes. But you know what I mean? They listen when you come in with that approach of like, I want to be on your team. I want to help this person. Let's work together and see how we can figure it out. I'm going to make your life easier. You can make my life easier. Kind of, I scratch your back, you scratch my back.
That's
sort
right.
of thing. Yeah.
So I'm sorry. So your clients, the most of them, they just come from the hospitals, or
not always
at home?
It really depends. I kind of have people all over the place. I have somebody a 45-year-old who had a stroke and is a quadriplegic now. So she's in a nursing home. So that's somebody that I'm helping to try and get out for a medical waiver, or the community waiver program, or REM. So we're working on that together, and I have another client who's just very sick, had cancer, and is in and out of the hospital all the time, and is just fed up with, she's very medically complex. So every time she has to go in and out of the hospital, she'll sit there for a day or two while they try and figure everything out. And she's like, I've already got everything figured out. Just send me home and I'll do it, And so she hired me to kind of help, put that fire under the rear ends when it's time to go home. Like, she knows what she's talking about. We need to listen to her, and she'll be fine.
That's okay.
Yeah. So it's all different.
Mm-hmm. Okay.
So Ashley, I do want to ask, with all the patients that you see, are you ever overwhelmed by all these cases? Does it drain you? And if so, how do you recover from that? I know you said you do your focus time in the mornings, but how do you recover from seeing so many patients that are ill?
That's a good question. And I feel like any nurse or anybody who's like working bedside or with clients like this, it's hard. And, sometimes we cry. Sometimes we get upset, and we cry with our patients or cry after we leave or whatever it may be. But like you were saying, I try to take time for myself, and then I try to look at as much positive outcome as I can, and I think like, oh, I feel like I haven't done much, I'm really trying. I keep doing this and I'm hitting a wall multiple times over and over again. And I know this sounds crazy, but sometimes I'll use ChatGPT or Gemini and talk to it. It's like, you know, they have that conversational feeling or whatever feature. And I'll be like, I did all this, but I feel like I haven't done anything. And I'll be like, well, no, look at it this way. You have done this, this, and this. And then that makes me feel better and look at things in a different perspective. Like, okay, yeah, it's really sad, but I am making a difference in these people's lives. And that's what keeps me going, is that difference that I'm making. And, you know, that glimpse of hope that people may not have had before that maybe they have now, you know, something to look forward to.
Yeah, and that's got to be rewarding. So that's good. Are all your patients adults? Do you have any minors?
I don't have minors. I have not. I've always worked with adults. So I always say that I help people over the age of 18. I don't have that much experience with pediatric patients. So I could probably help do like general, you know, advocacy for them, but I don't, you know, have that bedside or ICU experience for pediatrics and things like that I would feel comfortable doing. So.
Yeah, because some of them don't have the parents there, you know, and
Right.
there are some parents. It's so unfortunate because there are some parents that really don't understand this process. Me being one of them. I mean, it's definitely sometimes a baptism by fire, but I think some of the hospitals, and from what I remember, they had patient advocates, but the times that my daughter was there, I didn't find it to be helpful at all. I found that they just came around and they just made promises that they could not keep.
Exactly.
Or, you know, they, you know, kind of was like, well, how's things going today? More like a mental check-in thing. But I'm like, when you're trying to navigate that process, even if you're a parent with hands-on, you can get lost in a system that is designated to kind of keep you in the dark sometimes.
Yeah.
And so even with the parents that's hands-on, sometimes that advocate is very important. But one thing that I did have, they did have with my insurance, they would have someone to call to try to help me with scheduling my daughter's appointments, which to me, it wasn't as helpful, because if you're not there with me, me calling you to say, hey, she has a neurology appointment this day. Oh, she has this. It was almost like it made more work for me to call them, to have them to put her stuff on a schedule. When I'm like, I would have to call you to say, listen, she has a neurology appointment. They would have to call me back to say what day works for you. So it just didn't make sense to me. I do know a lot of the insurances do have that, and they did say, well, we want to help you with scheduling her appointments. But I'm like, that's another layer. I don't have time to that's too much.
Yeah. There is, I mean, obviously there's other people who do advocacy, like independent advocacy, like I do. There's a website called GNA Now, so it's Greater National Advocates. And you can specify in there if you want somebody who does pediatrics, or if you want somebody who does colon cancer or breast cancer, that sort of thing, because there are advocates who specialize in different things like that. So people can look on there if they did need a pediatric patient advocate. I guarantee I know there's somebody, I think she lives in California, that's in a group that I'm in that does pediatrics, you know, because they were in the same boat you were, where they had a disabled child or whatever it was, you know, they had all these medical complexities and they were trying to figure all of it out, and they felt really overwhelmed. And, you know, and sometimes, you know, you know more than most doctors, right? You go in, like, you self-diagnose yourself, you diagnose your kids because you live with it every day. You know, you've done the research, like, why does this hurt? Why is this, you know? And so you kind of have an idea before you go in. And I remember when I was working at University of Maryland, it's a teaching hospital. So there's a lot of med students. And there was one attending, you know, she had her little ducklings, her little med students behind her. That's how they'd always walk through the halls with the attending in the front and the little students in the back. You know, and she was saying, like, you need to listen to your patients. They they really, because they would come in thinking they knew everything because they just read it out of a book or whatever it was. And she'd be like, no, listen to your patient. That's what you need to do, and it goes a long way. And I found that when you really listen to what people have to say, it makes a big difference.
Right.
Yeah, it'll make a huge difference. I did want to ask, with the network that you just spoke about with the advocates,
Mm-hmm.
is that covered by insurance, or would the parents need to pay out of pocket to get someone to come in and help them advocate for their minor child?
So it is unfortunately not covered by insurance. It is paying out of pocket, and I do charge out of pocket for my services. But a lot of times the way that I frame it is that I usually can make up the money that you've paid me by saving you money somewhere else. For example, I have a client, who was supposed to be going home from rehab. They were told they had to leave, and they were saying, oh, we can't go. Like, I can't walk, and I have 17 steps to get into my house, So the facility that they were at said, oh, it's okay. Just pay us for the room and board. We'll get insurance to cover the therapy, but you have to pay us room and board. And that's going to be $14,000. And the woman was almost ready to hand a check over. And I said, oh, no. We put in an appeal, and we won. Okay. And she did not have to pay them $14,000. So there are certain things that, again, it is a lot of money, and sometimes it's sticker shock to find out what people pay for advocates, but it's worth their weight in gold. And like you were saying, with the advocates that work at the hospital, they work for the hospital. The people who work as advocates for the insurance, they work for the insurance. I work for you, and I can help you, do navigate that and hopefully save money somehow or another in another way. So.
Yeah, it's just unfortunate that even the advocates that work for the hospital don't really show up and support the patients like they really should.
Yeah.
And I won't say that happens everywhere, but I can honestly say the experiences that I've had, it has not been helpful to me as the parent. I mean, it's like, even I know before one of my a surgery my daughter had, they had me coming like a month or so beforehand to do all the workup and to find out everything she needed. And they did a lot of this beforehand. First of all, they did not have everything in the system correct about her. Say like I think they had her as having a bone marrow transplant. I'm like, where are y'all getting this information from? So the fact that you have incorrect information, you can't be a patient advocate. That's the first thing.
Yeah.
And then after she had the surgery, nothing was in place. Not one thing. So I'm like, wait a minute. What's all this stuff y'all had me coming up here for a month in advance to do all these workups to find out what's her daily, like her day looks like, what she needs, what she doesn't need, the food that she eats. It when after we did all of that, after her surgery, nothing was in place. Nothing. No, okay, no therapy afterwards, no, her going to a rehab, nothing was in place.
You needed Ashley.
I needed Ashley.
Yeah.
And it was a battle with the hospital and the doctors to get my daughter what she needed. And here I am trying to help her with her recovery, which was always somewhat strenuous because she's nonverbal. She has cognitive disabilities. So she didn't even understand that. But everything that they told me they were going to have in place, they had nothing in place.
Yeah. I'm actually doing a next Thursday, a week from today, a webinar on 5 mistakes that families make during hospital discharge, because that's one of the things is, not realizing that like you need to push people or really ask questions about that sort of thing, because and I used to work in the hospital too, doing case management a little bit here and there, and you'd have 30 patients. Like, how in the world are you supposed to coordinate discharge and all these other things for 30 patients when it takes, you have to call facilities, you have to upload all this information, you have to, it's a lot. And then you have all these different insurances with these horrible Medicare Advantage plans and all this stuff where, they tell people, oh, we'll give you free groceries, for a year if you sign up with this. And then they're like, but you can't go into any nursing home, or we're not going to send a home care person out to your house because you're not in network with anybody because you live 30 minutes away from this facility. It's just crazy, because I have a client who's got, they didn't even know they were signing up for a Medicare Advantage plan. And they were signing up for Johns Hopkins Medicare Advantage. I don't know. The name is in the anyway, they didn't know. And now they live in the middle of nowhere. And because they live in the middle of nowhere, of course, there's no home health care agencies who can come out and do skilled care. So this poor woman has to drive to a facility to see her husband every day. That's 45 to an hour drive every day. And now they're trying to plan the discharge, and they can't find a home health care company to come out to help him. And he can barely stand up because there's only one home care agency that takes their insurance in their zip code, and they're full to capacity and they have no room. And yeah,
that's why I need to live close to the city.
Yeah. I mean, and
people live too far out.
Yeah,
in the rural areas. But some people have lived there for years, and they don't expect, when you move somewhere, you don't expect to be somewhere until you get 90 years old. Who thinks that? I mean, and who plans for that? But it's almost like these days you really have to. And I say, in my case with my daughter, you're right with that discharge. That they shoved so many papers in my face just to get me out that hospital.
Yep.
But my daughter could not walk on her feet. Nobody, and we had steps in our home. They sent me home like that. We had to end up coming back to the hospital. They had to readmit us. I mean, when I say I was so disgusted, so I would advise everybody, you gotta know your rights.
Yeah.
And a lot of the times with them patient advocates, they work for that hospital. They shove so much stuff in your face, and they will see the need and they don't even care. It's sad.
Yeah.
It's sad.
Yeah.
So I will say that I experienced that firsthand. It was terrible.
Thank God for people like you, Ashley, that can go in and help families.
Because I had that issue when I was in the hospital. They just weren't listening to me. Finally, I was like, you're not listening. And my sister would come, and I would tell her, the nurse, and she would tell the nurse, Finally, they would listen. I'm like, why are you listening? You need to listen to me.
Yeah.
And being a little person, I could not get out of bed because the bed is so high.
Yeah.
And I needed this. Well, we don't want to give you a stool because you might fall. Then how am I going to get out of bed?
What do
I
do?
can't sit in the bed all the time. And I have spinal issues, and my legs were going numb sitting there. I said, I want to at least sit up in a chair. But you're a fall risk. Okay, help me.
Yeah.
Help me get out of bed. I mean, it was miserable. Finally, I had a nurse that did that. Got me out of bed, put me in the chair, and she sat there with me. But it was just like a battle. I'm not asking for a lot.
Yeah.
So what would you have done in that case, Ashley? Give us an example with Madeline. Tell us what would you have done in that case.
So for somebody like that, in a situation like that, you can do family meetings. And in the hospital, that's what they're called. In a rehab center, they would be like a care plan meeting. And you'd want to get everybody, the doctor, physical therapy, nursing and all that together, and really come up with a nice list of questions or comments or goals and whatnot, and just get everyone together on the same page and have them listen. Because I feel that's really the only way. Otherwise, people are just kind of rushing around everywhere, going to see their next patient. They're not sitting down and actually paying attention to what you're saying.
Right.
So that's a big thing that people can advocate for is, family meetings, and organizing that, especially with the doctors, because they're the ones that are writing the orders, and they could write an order that you needed a cyst or whatever it may be, that they'd have to come and help you because, they don't want you falling, that sort of thing.
Because I remember one time I was saying, I know I'm not the only little person that comes in here. I know I'm not the only patient that comes here, little person. So did you have to have something for me? I was just so frustrated.
Yeah.
Like, okay, no one listening. Everyone's walking back and forth. And then, if you get too hyped, they're going to look at it like, okay, she's the problem. And some nurses not going to want to deal with, right. So my cousin, he's a nurse, and he was saying, just calm down. I'll say, yeah, it was an experience.
You almost need an IEP for the hospital.
Yeah.
Okay. Yeah, it was something.
I was thinking about that, like a 504, because they should have had like a bed for little people. It's like,
absolutely,
that goes all the way down to right.
Yeah, that's an interesting point, because I mean, they have to do like ADA, you have to do all these other things. Like that should be something that they do, that they
Madeline, we're gonna all come and advocate for you. Next time you're in the hospital, praying that you don't have to go. But you got us. We coming. We're gonna advocate for you.
Because like I said, I know I'm not the only one that comes here.
But how do you interact with the families? I know you said that you had somebody in Hong Kong. How is it that, like, if somebody is going through something, it seems like you become a part of the family in a sense.
Yeah. It's so I can do, in person, virtual, or, emailing, calling, all that sort of thing. Okay. It is a lot of emailing, especially with somebody in Hong Kong, because, the time change is so different. And that's one of my newer cases. So it's a little more in the beginning stages of like trying to navigate that and trying to figure that out. That's one of the farthest people. Most of my family has somebody who lives with them or somebody who's not far away. And they just needed that extra support because it was just too medically complex for them to handle, somebody on TPN with, surgeries planned and et cetera, et cetera. Those are easier because the family's there. You can kind of involve everyone. You do the like chain or the group text messages or group emails, and really getting in there to talk to the facility, so because it's like a particular person, a lot of the nursing homes are the ones I deal with. So I try to take the lead on that and like talk to the social workers to try and figure things out and then explain it to the family members separately from the social worker to kind of put it on their level. You know what I mean? Because sometimes I feel people, again, they're rushed. They may talk to people all day long and they don't realize they're using this medical jargon that nobody understands, and sometimes people get stressed out. They don't hear everything that you're saying, and you can say the same thing over and over again, and it's not sinking in because it's just a lot of things happening all at one time. So I try to make things as simple as possible to understand and explain to people, multiple ways. I have a client who was, trying to head home out of the facility, and they kept saying they needed something to help get their loved one out of the bed or whatever it was. And so I kept explaining what I thought, and I was like, I'm just going to send a picture. So I went on Google, I took a screenshot of what I was talking about, and I sent it to her, and she goes, oh yeah, that's exactly what I need. Like a trapeze thing to pull yourself out of the bed. I was trying to explain it, but it's all what people really need and what their goals are. Because I can't help you if you don't know what you want. You know what I mean? Like, if you don't know what you want, I don't know what you want. I don't have a crystal ball. I always ask people if there was something that I could do right now. If I could wave a magic wand and help you do this one thing, what would it be? And usually I get pretty good answers, and then we can kind of get things flowing from there. For example, I have a client who's just very overwhelmed with all the medical stuff. So they were saying they wanted a way to organize everything, all your doctors, all the medications, what surgeries you've had, et cetera, et cetera. So, took all of that. I'm in the process of trying to organize all of it and give it to them in a nice binder that they can take everywhere they go, to the doctor's office, so they don't, because, I went over there a lot of, when I do my intake visits, we go through my chart, or whatever patient portal they have. And I find that a lot of people don't realize how much information is in those portals, and that you can actually see doctor's notes. It's not just the, discharge summary that says stop smoking and, you were here for this and we did a chest x-ray and you're fine, go home. It's the whole history of what happened with you whenever it was, what we did today, what the plan is going forward. And I find those are way more obviously detailed and tell more about what the plan is and where the path is going for people. Educating people on that, and obviously being your own advocate, and as best as you can, or showing family members how to do that. Because I had the first client that I had no idea anything about my chart, and so I spent like 2 hours in there showing her how to message the doctor, how to do all this stuff. And, you can add people into your my charts as a proxy and that sort of thing. And so sometimes people will do that so I can get updates on their appointments or doctors' messages and things like that. And it was just nice to see after I showed her and she felt so lost. I kept seeing all these messages go back and forth between her and the doctor, like figuring things out for her husband. Like, all right, she's got it, she's figuring it out. So, some of my clients are ongoing. They need the help over and over and over again, and they buy more hours and they buy more hours. And some people I just help for a certain amount of time for a specific subject or whatever it may be. And then, they're good because they learned how to do it, and maybe they'll come back in a couple of years if they need more help again. So.
Yeah. Actually, I heard you mention that you need the patients to let you know what they need because you don't have that crystal ball that you don't know. Now, what happens if you have a patient that has special abilities, nonverbal, and maybe court appointed? Someone reached out to you to advocate for that person. What happens in a case like that? How would you advocate for that person?
So I have not had a court appointed person yet. I do have a client who is nonverbal. They had a massive stroke and whatnot. So they have a lot of family members who knew, what they were before. They were a walkie-talkie mother who worked full time. And so obviously the family knows, like, she wants to go back home and be with her family. So I've never obviously spoken to her because she's nonverbal. I go through her family and they know what her wishes were. And so we really try to figure all that out by going through the family. I'll be honest. Like I said, I have not had anybody who's court appointed who is nonverbal or something like that. But I mean, if it was something like that, I would request to see records and kind of look through and see if there's something that was missed or ways to make it better. For example, they might be on like 6 psych meds. Like, why are you on that many psych meds? Has anybody even looked at this in the last couple of years? Are you falling a lot? Are you very sleepy? Are you not functioning? Because is anybody checking your blood work, to see if your levels are okay, that your body isn't starting to like shut down because of all these chemicals that you're putting in your body. So, that's probably the best way to handle that would be really just to kind of be like an investigator person and go through and look through all the notes and talk to some of the care team and whatnot to try to figure out the best way to help somebody.
Yeah, I just thought about that because you've got, we always say small children with different abilities grow up to be adults with different abilities, and some are nonverbal. And then I just was thinking about if you go into any group homes with some adults that may not have family members, and staff may call you in to advocate or try to help a person. So I just wanted to know what your level of experience was with that, dealing with
Yeah.
those. Yeah.
Yeah. Yeah.
Yep.
So, yeah.
I heard you say something about people by hours. How does that work? Do you have
Oh,
like
yeah.
packages where you have 50 hours, and how do they go about doing that?
So I have packages of 5 hours or 10 hours. So I usually
Hmm.
suggest um, if you buy five, if you need something like you just need help with a Medicare appeal and you need help getting dad home or whatever it is, that's not something that's ongoing. You probably may need just 5 hours.
Hmm.
And then if it's something that's ongoing, somebody who lives in an assisted living facility that is cognitively there, but doesn't have the physical abilities to like make phone calls to schedule an acupuncturist or whatever it may be, that person would probably need 10 hours
Hmm.
of time, because it would be something that I'm continuing to do over a course of period, ongoing.
Hmm.
And so people buy the time. I do free consults, where I'll talk to people. And a lot of times I'll say, like, obviously I'd love you to hire me, but if you don't hire me, you need to call the ombudsman and talk to them. And then I would call, this program here to see if they can help you. But if you run into any roadblocks, that's where I come in, or if you don't even want to try that and you want to go ahead and hire me, then we will go ahead and do that. And again, like I said, I do a lot of these consults where sometimes I give, like I said, sometimes people are like, I need you right now. I don't even care what you have to say. I come on and jump on ship
Yeah.
here. And then other people need a little more time and, go through different. Yeah, and I might not be the person they're looking for. I know I have some people who call me asking for help with placing their family members in an assisted living. And I'm not going to do that. That's not, I can help you with that, or I can show you somebody who will do that. But that's not really what I want to be doing is, going and touring facilities. But there are people that do that. So I will give you their information. Um,
Oh,
yeah.
I love
So
that about that. You
so
charge
you
by the
got,
hour. I like that.
yeah.
Hmm.
yeah, yeah. So, and I found that like the 5 and the 10 hours for now, for the first
Hmm.
year, it's been working well. And it helps because like I'm not chasing people like you owe me money, you owe me money. So
Yeah.
so I do the 5 hour package, and
That
then
is
uh,
that's really smart.
what's that?
Yeah, that's smart. I'm sorry. Yeah.
Okay. So yeah, so I'll do like the 5 or the 10 hour package, and then I track all my time. And then usually when it gets down to half an hour or so, I obviously send monthly summaries at the end of the month. And then, but if it's before that and we're running out of time, I'll say, you have 30 minutes left. Did you want to go ahead and buy another chunk of hours, or how you doing? You doing okay? That
I
sort of
like that.
things. Yeah.
That is nice. I like
Yeah,
that's like a lawyer. That's all
yeah,
you know how the lawyers do that. I like that though.
they're not locked in on, keeping your service for a month, 6 months.
Mhm.
They can just pay by the 5 hours or 10 hours. I like that,
Yeah. Yeah. That's how a lot of
and it's affordable.
other advocates do it. And I was like, that's a good way. Like, I mean, again, I don't have to run after people asking for money.
Right.
And I can say, like, you're out of time. I can help you a little bit, but I'm not going to like hold your hand as much as I've been holding your hand. You know what I
Yeah,
mean?
because
So,
realistic, that's your job. I mean,
mhm.
this is how you pay your bills. The need
Yep.
is there. I mean, it's amazing because I always wonder how did people survive back in the day?
Mhm.
When when it came to, like I remember my grandmother and my grandfather them going to the doctor, the family was there. It
Mhm.
just seems like it's a different time right now where it's like there's a lot of people who don't have anyone that's looking out for their well-being. So it definitely is a void and it's a need. So I definitely commend you. Um it's a lot to kind of sit in there and hear some of like the diagnosis and the prognosis and all of that. That's a lot. It seems like, yeah, I would have to be in there doing exercise and I would probably go out
Yeah.
of appointments being mentally and physically drained. Because even when I went to my daughter, sometimes I would leave like, good Lord. So
It's a
I
Mhm.
can
lot.
imagine you.
Yeah.
That's
Oh
why I said
man.
it's got to be overwhelming just to be around so many people that have a need, people
Hmm.
that are sick, people that just can't speak for themselves. It's got to be just overwhelming. I think I would need more than just that short time that you take to sip coffee. It's got to be something else that I need. So it's God blesses people like
Mhm.
you
Yeah.
to do a job like that because everybody can't do that.
Hmm. Yeah,
Yeah.
yeah, yeah. I mean, and it's not, obviously that part is really hard too, but also just like trying to figure out how to do your own business on top of that is hard
Oh
Right.
too,
yeah.
Yeah, don't we know
Ins
it?
and outs.
When my mom was ill and I had to, help her and advocate for her, it's a lot. It
Yeah.
takes a lot out of you, especially if you don't know how to navigate what's going
Mhm.
on. So
Hmm.
people like you, Ashley, is definitely
Yes.
needed.
I think I'll
Definitely
do it.
needed.
Yeah.
Yeah, yeah. Thank you.
Hmm.
Yeah.
Have you
So
ever
you,
had any bad situations with doctors that kind of, denounce you being in the room or, dismiss you in any way?
Trying to think. To be honest with you, I feel like in the beginning, every conversation I have with people, they're always a little skeptical and they're like, I don't know about this girl. But I feel like I have a pretty good personality. And
your
I,
approach
I
is good.
again, I really try to work with everybody.
Hmm.
And so after, at first people are like, what? And then, like the client I have who's in this facility that keep getting these denials from the insurance company, and then we appeal them. Now we're on our third appeal that we've won. This is they try to discharge him. We appealed it. We won. Discharge him. Appealed it. We won. Discharge it. Appealed. We won. Now the facility is asking for my number to give to other people
I
because
love it. I
That's
love
Great.
it.
good. That's
That's
good.
great.
Yeah,
yeah,
I love
Great.
it.
yeah, because
Yeah.
the woman was like, the staff here wants to know if I know somebody on the inside of the insurance company because they're trying to figure out how we're still here.
But it's your knowledge base. That's because you know how things work.
Yep.
Hmm.
Yeah.
Yeah, yeah, and I mean, I think that when you put that whole picture together, a lot of what I do is, doing supporting letters for people when they do these appeals, and you kind of outline that whole picture, and you pull in legal things where they're and this year and this date there was this court case that said that if you are making progress in a skilled nursing facility, even if it's minimal, that you still have to be covered by insurance. And then they're like, oh
Right.
yeah, and then they're like, okay, he can stay. So it's things like that you kind of have to remind people, or say, well, if you send him home, he's going to end up back in the hospital, and then you're going to have even more bills to pay. So I think you should just pay this cheaper rate while he's in rehab instead of a hospitalization rate, and all this
That's
workup
right.
and surgery or whatever he
Wow.
may need. So,
And that's what they did with my daughter with that situation. The insurance company actually was never contacted. So when they
really?
contacted me and they found out we were home, they were like, "Why are you home?" I said, "They said that you guys denied her going to rehab." They said they never even contacted
Oh
us.
my
This is
gosh.
why I'm saying this is they were the ones who told me go back to the hospital. And again, because this is the
Wow.
first time this has happened, she said, and I'm saying this, I know we had just come home. I was like, what are we gonna do? How are we gonna get through this time? And she said, go back to the hospital. She said, and I'm telling you this because if you don't, your daughter's gonna fall and you're gonna end up having this surgery all over again, and then it's
Oh
gonna
my
be
gosh.
other issues.
Yeah.
So
Yeah.
they're the ones that told, and I will never, ever, ever forget the girl's name that called me to say, I saw that you guys were discharged. Her name was called Miracle.
Oh
Really?
Really?
wow.
No.
I will never, ever, ever forget her name. She
Oh,
said, go back to that hospital. She said,
wow.
and come to find out, her orthopedic doctor never contacted the insurance, even though they knew we had steps at home. He said he knew they were going to turn us down. I said, but that's not your choice to make.
Right. He didn't even
Right.
give them
That
an
wasn't. Yeah.
opportunity.
Where he felt like a dummy because when he called them, they approved everything.
Mm,
So I say this just to say, number one, it's you're right. Actually, it is so important to know that process because that was the first time my daughter had surgery up to that, of that magnitude. I
hmm.
didn't know all of the pieces. I didn't know anything. I was just relying on them to tell me everything.
Mm-hmm.
But number one, I feel like you're right about that portal. When I was sitting here listening to you about the portal, the first thing I thought about is when you have that after that summary that comes after
Hmm.
your appointment, people need to really read that because a lot of the
Mm-hmm.
times it's misrepresented. They don't
Hmm.
I've had sometimes where they put other people's information in my daughter's record. So a lot
Right.
of time, like you said, they're moving so fast that you got to make sure that that discharge report or that after visit report truly reflects what
Hmm.
actually happened with your appointment, because a lot of the times it's not accurate. And like I said, when they had her and she had a bone marrow, I said, listen, take that off, don't put nothing on her record that's not supposed to be there. And I'm like, how in the world you putting bone marrow?
Yeah, that's that's pretty crazy.
Trying to double book patients. Mm-hmm.
Yeah, like you were saying that after visit summary. So usually there's an after visit summary, or even a discharge summary is
Mhm.
even more detailed, or clinic notes in my chart or whatever it is are more detailed. Because I've had clients where, somebody was having issues with some depression and they went into the doctors and mentioned something to the doctor, and then they get home and when you have a my chart, that epic printout that you get with the after visit summary, it says your list of medications. Well, this said for his medications that he should take a half a pill when he was already on a whole pill, a half a pill of his psych meds, his depression medicine, and then after a week increase it to a full pill. So the wife was like, okay. I questioned, I said, well, didn't he mention that he was having more depression? Why would they lower the
Right.
dose of his antidepressant medicine? And she was like, I don't know, but he's been taking it that way for a couple of days. And then she was complaining about how he was having issues sleeping and more irritable and blah, blah, blah. So I go back and I look in the notes, and I looked at the actual clinical notes, and it said he probably needs to go to 1.5 pills. But what happened was they never changed the instructions on the printout that they gave the patient from when they first prescribed it. Because when you start that kind of medication, normally you start a half a pill and increase it so you can make sure you can tolerate it. But so they never explained any of this to him. They just printed this old instructions out, and his wife didn't go to the appointment with him, so she didn't know any better, and she didn't. So then I showed her, you need to go look at the actual the instructions and what the actual doctor wrote, not just the summary of everything, because you'll find even more information in there. So I mean, it's just little things like that people don't realize that.
And they did say on some of my daughter's things, oh, mother declined to be educated on this or that. And I said, they ain't never even asked me. So it's
Wow.
like they just used to just checking stuff
Yeah.
Mm-hmm.
without
Oh yeah.
even asking you. And I'm like, no, 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 because that no one asked me. And then like they did, and I'm like, no. So how you gonna say mother declined to be educated on the
They didn't feel like
medication?
doing it either.
Yeah, or the choice. Mother,
Yeah.
Yeah.
we offered her A, B, and C, but she accepted D. I said nobody ever gave me a choice.
Yeah.
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 So you gotta really be careful with this. Ashley, this
Mhm.
has been awesome. Oh my goodness. This has
Yeah.
been an awesome podcast. Just so important to understand your health. Oh, so important to understand, if you don't have that advocate and you're not in a place to really understand, you need to definitely get an advocate. Even if it's to go to the doctor's appointments, it's to help you understand your medication, to help
Mhm.
you understand that total process. definitely need to reach out to somebody like Ashley. So what I'm gonna do is give Bunny and Madeline some close out, and then Ashley, you close us out.
Okay.
Well, Ashley, I appreciate hearing your story and how you've experienced illness yourself, and now you're helping others to um, be able to better enjoy life. So I just appreciate people like you, and God bless you for all that you're doing for those that can't really advocate for themselves. God puts you in their path so that you can help them to get everything that they need. So I appreciate that about you.
Thank
Mhm.
you.
Yes,
Madeline.
you are a blessing. You're the voice for everyone that
Yeah.
Mhm.
needs them to be heard. And like I said, you went through your battles and you were on that side. Now you're on this side so you can see
Hmm.
exactly what others go through and you're able to help them. Thank you
Thank you.
very
And
much.
thank you guys. It's been great. And I even learned a few things when I was listening to some of the old podcasts when I was kind of looking around what you guys do, and I was like, wow, I
Mhm.
should listen to more of these. You guys.
Yes,
Listen,
definitely.
Yeah.
listen. And
Yeah.
we definitely want to close out and let everybody know we have our first annual walk coming up on November the 8th. We are so excited. It's in Oxon Hill. It's at where is it, Bunny? Don't
Henson Creek.
Yeah,
yeah,
Henson
but
Creek
it's
in Fort Washington, Maryland.
Yes.
but they
Yeah.
told me it's not really called Hinton Creek. It's called
Tuck,
Oh,
Tucker
Tucker Road.
Tucker
Tucker
Road
Road.
Community Center, and that's in
Community
Uh-huh.
Center.
Oxon Hill. It's going to
Yes.
be from 9 to 12 o'clock. We're so excited. It's going to be a 3K. We're going to have giveaways out there. We're
It's
just
gonna be
so
fun.
excited about this. Yes, we're
Yep.
so excited.
You should
So
come on
please,
down, Ashley.
huh?
Okay.
Yeah, so we
Yes,
ask
thank
that everybody start lacing up them shoes. Get you a good pair of shoes. You got more than enough time. Today is September the 11th, so you got more than enough time to get out there and join us. So we thank you, Ashley, again for joining us, and we appreciate you. We
you. Yes,
appreciate
thank
all
you
that
so
you do,
much.
and we ask that everybody have a wonderful weekend. We will see you next Thursday for another subject and another episode of Advocacy.
All
All
right.
right.
Thank you. Good night.
Good night.
Bye.